Welcome to the Make It Personal podcast presented by Mutual of Omaha Advisors. Make it personal. It's your money. It's your plan. It's your future.
What is your plan for healthcare and retirement? Or maybe you're already in retirement and trying to make heads or tails of Medicare Supplement or Medicare Advantage. Medicare can be confusing. We get it. In this episode, we'll walk you through 5 questions to help you in determining which Medicare solution may be the best fit for your needs. Things can get confusing when it comes to health insurance and retirement, specifically Medicare. According to the U.S. Census Bureau, nearly all retirees age 65 and older are eligible for Medicare, with estimates placing the percentage around 98.9% of adults in this age group qualifying for coverage. Growing older often comes with a few health hiccups. Healthcare options in retirement, from Medicare to long-term care insurance, required forward-thinking defense strategies to guard against the high costs. If you plan for different scenarios and make sure you have enough resources available for the road ahead, you should be able to tackle whatever life sends your way. My name is Mark Zagurski, and I'm the Director of Strategy and Communications for Mutual of Omaha Advisors, a division of Mutual of Omaha. Mutual of Omaha has been involved in Medicare for nearly 60 years since the very beginning of Medicare. With Medicare's inception in 1966, Mutual was selected to administer both Parts A and B of the program. When deciding between Medicare Supplement or MedSup and Medicare Advantage, there are a lot of factors to consider. Who are your preferred doctors? What are your potential healthcare needs? Your desired level of out-of-pocket costs, and whether or not you want flexibility in choosing providers. Generally, MedSup offers more provider choice with higher premiums, while MedAdvantage might have lower premiums, but you may be limited to a network of doctors and could have higher out-of-pocket costs for certain services. Control, flexibility, options are all important things to have in all facets of your retirement planning, including healthcare in retirement. Medicare Supplement can be added to your existing Medicare Part A and Part B plans to help cover some of the out-of-pocket costs you may be left with. Medicare Advantage plans, also known as Medicare Part C, cover the benefits of original Medicare Part A hospital insurance and Part B medical insurance. Plans may also offer benefits like dental and vision coverage, discounts on gym memberships, and extra savings on over-the-counter medications. Certain Medicare Advantage plans include prescription drug coverage, known as Medicare Advantage Prescription Drug, or MAPD plans. Sounds like a lot to process, and it can be, and that's where a Mutual of Omaha advisor can help. As a matter of fact, our advisors have a handful of simple questions, 5 to be specific, that they can ask you, and then they'll be able to recommend which Medicare solution we think is the best fit for your needs. Here they are. Question number 1. After you enrolled in Medicare, will you continue to be covered by an existing plan? This could be through an employer, a spouse's employer, TRICARE, Medicaid, or another health plan. Yes, I will be covered, or no, you will not, or are you not sure? The first question is pretty basic, though it helps an advisor to determine what the need is for coverage. In some situations, you can have both private insurance and Medicare, such as if you're covered under a private insurance through an employer. When you have private insurance and Medicare, one provider will pay for healthcare services first, and then the second may potentially cover the remaining costs. This depends on your situation and the type of private insurance you have. Question number 2, would you be comfortable only seeing doctors who are in a health insurance plan's network? Again, Medicare Supplement generally offers more provider choice, while Medicare Advantage can restrict you to a network of doctors. So yes, you're fine with being restricted to a network of doctors, or no, you always want to be able to see the doctor or specialist you choose, or you don't have a preference. The answer here allows us to begin to narrow in on the proper choice for you. On to question number 3. How often do you plan to travel or be away from your primary home? And how important is it to have access to non-emergency out-of-state care while traveling within the United States? So either yes, I spend several weeks away each year and may likely require non-urgent care, or no, I make short visits to friends and family a few times a year. Do you plan to travel frequently, sometimes, or rarely, or never? Because most Medicare Advantage plans revolve around a provider network, you may not be covered for routine visits while traveling domestically. Medicare supplement insurance plans don't have networks, which allow you to see doctors around the country as long as they accept Medicare. Both plans have protection in place for urgent and emergency care. This takes us to question number 4. How do you feel about having your primary care physician coordinate your overall health care? Do you like the idea? Would you rather choose your own doctors, or do you not have a preference? If you're considering a Medicare Advantage plan, you need to first check to see if your current doctors are in the network. You may also need a referral from your primary care doctor to see a specialist if you are on a Medicare Advantage plan. With Medicare supplement insurance, you can see any doctor in the United States who accepts Medicare. If we stop there at the first 4 questions, it would seem to stack the deck a bit towards Medicare supplement, as it may provide you with more flexibility in choosing the provider you want to see and where you want to see them. Question number 5, however, comes down to cost. What are your premium payment preferences? Are you looking for a plan with a higher monthly premium but pays more of your costs? Or do you prefer a plan with a lower monthly premium but which you may have more out-of-pocket costs as you use the plan? Generally, Medicare Advantage plans tend to have lower monthly premiums but may have higher out-of-pocket costs. Medicare supplement plans tend to have higher premiums but may have lower out-of-pocket costs. Control, flexibility, and options. What are you looking to accomplish with your health insurance coverage in retirement? So what's the next step? Connecting you with one of our Mutual of Omaha advisors. We are nearly 1,000 strong, and quite frankly, you may be listening today because of an advisor that referred you to us. What they would do is sit down with you in person or virtually to better understand your healthcare needs. Once they gather your answers to these questions, they're able to put them into our Navigator system, which will allow them to generate a customized recommendation for you along with the reasoning. If you're listening to me today while also viewing me online, here are a couple of examples of what that customized recommendation may look like. In some cases, Medicare supplement may be the recommended choice, and in others, it may be Medicare Advantage. The good news is that our Mutual of Omaha advisors are generally able to help serve your needs regardless of which plan may be most suitable for you. It's never too late to create a plan that aligns with your aspirations and gives you the peace of mind knowing that you have a roadmap to achieve all that you want from life. The truth about making decisions about health insurance and retirement and Medicare, as well as other financial goals that you may have, is that they can be solvable with the help of a financial advisor. There are a lot of places where people seek financial advice or guidance on personal finance. The thing about personal finance is, well, it's personal. If you want your plan to be personal, it has to be tailored to you. Take control of your future and schedule a no-obligation consultation with one of our advisors today. Go to www.makeitpersonalpodcast.com to learn more, to get connected with one of our advisors, or to download our ebook. Also, please like and subscribe. What are your plans for health insurance and retirement? What is most important to you when it comes to choosing a plan? If you're watching or listening on a platform where you can comment, please do so, as we're curious for your thoughts. At Mutual of Omaha Advisors, we understand personal finance is personal, and financial well-being is essential to achieving your life's goals. Our vision is for every customer to be able to imagine, plan, and secure their financial futures. Make it personal. It's your money, it's your plan, it's your future.
This podcast is for educational purposes only and may include references to concepts that have legal and/or tax implications. Mutual of Omaha Investor Services, Inc. does not provide tax or legal advice. Please consult with the appropriate professional regarding your personal situation prior to making any financial decisions. Strategies discussed may not be suitable for everyone. Securities and advisory services offered through Mutual of Omaha Investor Services, Inc., member FINRA SIPC. Mutual of Omaha Advisors is a division of Mutual of Omaha Insurance Company.